Thank you so much, Andrew, and the whole team, and Scott being there. Ladies and gentlemen, as it says, gone glimmering through the thing of dreams that were. I mean, I unquote, 2 days have passed just like this, and I think you have been kept very busy. So thank you so much for your continuous presence, open mind, and your discussions. Now, just very briefly, we are just coming down to the concluding session, which is again a very important part. But just to brief you, we had six thematic sessions during last 2 days, an opening formal session and a closing, which is ongoing now, and two parallel breakfast sessions, and all in hybrid module. We had 127 participants, which is quite amazing, from more than 50 different countries. And we had six new members participation as well. So I think it's been great over the last 2 years. And starting from the global health threats to health system resilience, from public health policy to moving on to interdisciplinary approaches for the human public health force. I think a lot has been discussed, and some of the hot topics like climate change and its related effects, and definitely touching base in different session with the current financial situation arising out of the circumstances. So with all that in mind, I think it's important that we culminate in a manner, because IANPHI is a voice and we want to stay as a voice. So I would request Dr. Eduardo Samoguro to come on the stage and start off with the Maputo statement. And I would also request the President, Duncan Selby, to please join him over here. Over to you, Eduardo.
So, good afternoon, everyone. So, come to the end. So, we are delighted to share with you the Maputo statement, but I haven't seen an agenda. And Amari, so beside the closing, the statement, I don't think I'm gonna have any other spot to share my final goodbye for everyone. So can get this opportunity as well to do that. I don't need to come back again. So, but I will start with statements of Sarah. Okay, thank you. Now it's more readable. So I want first to thank everyone that has spent last hours. And then one special is to the the Secretary General, so Niels. Last night, while most of us we were drinking some good wines and then dancing and other stuff, so Neil went out to the small room with no noise and then tried to work out on that. So Neil, thank you so much for the effort you have done last night. So you did not enjoy as everyone has done last night because of you full commitment or that. I think that is the demonstration, Niels, on you full commitment on you on that role. So I think IANPHI is the secretary of IANPHI is on good hands. So thank you for that, Niels. So if that was not for you, so yeah, Neil did a good job in trying to get that shot last yesterday. We have a longer comparing with that statement of this meeting. So now it's 2-page document. So I think it's much it's more addressing the discussion we had last night on who is the audience. I think with 2-page document, it fits for any and all audience, either science on science field or on the policymakers donor side, and even for the civil society and regular ordinary people. I think reading two-page document, it's much more easier. So can you go up, Sarah? Up. You are going down. Yes. From the top. Yes. Yeah. So in summer, what has been done? So we have simplified those old paragraphs that are related with what has been discussed in this meeting. So now, in general, the focus now are on the call to action. So there is a first paragraph. So I will not read. I think you can read faster than you can read faster than I can speak. So that's you. I guess you are reading right away the document. So the first part, that is where the meeting is being held and when. The second is the recognition, acknowledgement of the risks. So there are 3 paragraphs on that you have read. So we try to cover all the threat risks, challenge that global health is facing. So we believe that address all comments from last night on that. So, but I think you can read that through. So we try to be more easy to digest, not to pull in one paragraph, but in the 3 paragraphs. So I guess everyone has read that piece of the threat risk. So Sarah, you can go. So more. Yeah. So there are these 3 paragraphs. So the what we confirm so is related with the main purpose, that is strengthen health system. Second is related with the need to have NPHIs as a core pillar of health system, and then also the workforce that we discussed today about that. And the last one is that we have 2 great message yesterday in the opening, both by Africa CDC and by WHO. So Chikwe and Dr. Chikwe and Dr. John Kaseya. So we believe that is, we should not ignore that. I think that those are the strong elements for the get our statement stronger. So it's that the key message. Both of them is related with the national public health institutions. It's what we welcome. So next, I guess everyone has read that piece. So the comments will be at the end, so that everyone is reading the document at the end. Everyone can raise the hand and ask for, if they want to provide an input. Next. So call to action. If you remember yesterday, there were only 3 paragraphs. Now there's come to 6, if I'm not wrong, paragraphs. So we have expanded because there were a lot of requests. I want also to acknowledge that we received a lot of inputs last night, and some of those we received only this morning. And then we were working out the team that was involved in that, in the finalization. We tried to pick all comments. So if those that are sent feel that something is missing, but we did our best. The team has done the best they could to accommodate all of those. So those are the paragraphs. So the first is on the NPHI, the need to strengthen an NPHI or establish. There are countries that has not yet established NPHI. And then it's a paragraph with four sentences to ensure that there is a context on what is the added value of the NPHI. The second is on the networking, and collaborative surveillance. Yesterday, Dr. Chikwe mentioned a lot on the collaborative surveillance, this concept. So the independence on the NPHI, scientific independence of NPHI, that has been highlighted in this statement, in this declaration. So I guess everyone has been able to read. Next, go. And then funding, there is a lot of Sarah, yeah, the one. There we got some on the global funding. So we discussed last night the need of coming up with nice wording on when we speak on those different issues that are and threats and changes that are happening. So we try to frame that in that way so that it's clear, but at the same time we don't end up ourselves in the debate or polarizations that has been. I think Tracy mentioned this last night, that this is very polarized, and then we should avoid ourselves to be within the polarization. The observatories has been discussed a lot, so we did best to put that in the context that is well understood, the role, not only the need but the role. And then we discussed also during this meeting the issue of the lack of the metrics for social determinant inequalities, how to measure, how to track inequalities. And the last one is on workforce development. So as we see, we try to come up with a wording that most of you have provide you concerns that we should say the truth. We should not be involved in polarization. So that balance is not that easy. So the last one is what we commit to. So Sarah, you can go to the last, is the commitment that we have done. It's one single paragraph that summarize so what we do, what we commit to do. And then we discussed last night if in the prior version, what we commit to was before the call to action. But after discussion, there was a consensus that we should first say ask, so the call to action, and then we'll be stronger if what is our commitment come at the end. So people understand that there is a call to action, but we are providing a strong commitment ourselves to respond to those threats and crisis. So bringing this at the end, it's give more strong message that we also has a lot to do on that. So in summary, this is the statement. So those that I am the spokesperson. So the answer, I will not answer. I just share the statement. So all you answer, so please, there are a lot of people starting from Niels and others that has worked out on that document that they will answer. So answer is not for me. But yeah, Duncan, do you want to come in? Yeah, sure.
Thank you, Eduardo, and thank you, Neil, and the team, Ilayesh, Serho, and the team. I think what we could do right now is just listen to any comments that people might have. It's not a moment to do editing, but if there are any further thoughts or comments, please just share them and we'll listen. And then we'll take your authority to finalize this on the basis of this version of what we hear in the next few moments. So any thoughts or comments? Tracy?
So I just have two comments. Feel free to ignore. Oh, thank you. Thanks very much. Just on the third paragraph of the actions, the call to action, I wonder whether we include and responding to all threats to health.
Hold on, Tracy. Sarah, could you just go down? Move it, or is it up? Move it up.
Back so if it's back up to we commit to, sorry, the call to action. The third paragraph, the third bullet point from the beginning of that section. If you can't carry on back up. Oh, here we are. So on that, sorry, apologies. If we, third, oh, this is going to be painful. So I just, on that third bullet point and the scientific independence is whether it's worth adding in and responding to all threats to health. It's just that blinking in the independence.
Right.
So just one suggestion there. And then on the we commit to paragraph, again, just back to the kind of wellbeing economy is whether we add in something around also enhancing economic and fiscal stability, which is the role that NPHIs can play. So it may add too many words, but I'll just leave that with you for.
Okay, we've captured that. Thank you. John
Yeah, just one thing that, but maybe I didn't read it. Could you go? No, the other side, the other way, the other way, the other way. No.
It's up or down, up a bit, down a bit.
Yeah, observatory of social data. My feeling is that this paragraph, no. Come back to observatory. Observatory of the social determinant of health or inequity in health are developed or strengthened, and which in metrics. So it's very much on monitoring indicators, but there is no link. Yesterday we said there should be a link with action, and I don't see the link with programs and actions there. Yeah, it's linked to achievement of universal health coverage, but that's one way. There's others. So my impression is that it's still too much on the surveillance or on the indicator and the scientific assessment. So more linked to action, I would recommend.
Thank you, Jean-Claude. Any other thoughts?
An observatory is a structure. So be careful with the word. We should avoid, because we have National Public Health Institute and we speak of observatories. So someone that want to be very critical, so observation or assessment or whatever, but observatory is a structure.
Thank you, Jean-Claude. Quentin?
Thank you. This is a great improvement on yesterday evening, and I commend everybody who was involved in this. My only observation as a natural English speaker is that much of the narrative is written in the passive. And I just wonder whether we, to pick up on the point yesterday, could be a little more direct. And indeed, we could reduce the number of words in that process. So, for example, we're looking at the last bullet point, investment has increased. Just simply state increase investment in. Now, there are several occasions where I think just a simple translation from passive to active English would just help. And then my last point, and again, you may or may not want to agree with me on this. Can we go down to the we commit to bit, please? Well, I see that paragraph. We commit to. Stop. There we are. Great. Thank you. We commit to all of these things, but quite honestly, one is left with the impression we're trying to cram all of this into the bottom of the second page. And it doesn't draw out, it's not easy to pull out some of the important points here. It's very comprehensive, and I respectfully suggest that notwithstanding the liberal use of semicolons, it doesn't make for easy reading. So I'll leave it that,
Okay.
and you can ignore my comments if you wish.
No, Quentin, thank you. I used to have terrible difficulty with split infinitives. Sorry, Sue. What are you saying? You're seconding Quentin on his hyphens or his split infinitives?
On both of his comments.
Thank you.
Yeah.
Thank you, Sue. Natalie.
again, thanks to the colleagues who've presented this and worked on it. Incredible job. I'm just concerned that as we say we commit to, if the public health institutions who are not adequately financed to commit and deliver on this, we are going to lose credibility. And I think we need to phrase it in a way. I absolutely support Quinton's comments, but I think I'm really concerned that we're committing to something that not all of the public health institutions can deliver on. And that's going to really create a problem. Thanks.
Thank you. Yes. Shiva, can we have the microphone? No. Oh, well, Shiva and then. Okay. No, Shiva.
Thank you very much. Good afternoon, everybody. I just have one point regarding this evidence generation. As a National Public Health Institute, should we, the government or state member states should invest budget or finance for evidence generation. In my country, I raised a question why the government should not allocate budget for research, should be a research question itself. So is that not a way to advocate as IANPHI advocate for evidence generation to allocate budget by the government itself, if you get to my point.
Within MPHIs?
Yeah.
Okay, thank you.
Because it says we commit to evidence generation. So to generate evidence, we need finance, right? So we shouldn't expect finance from donors only or other investments. These national or sub-national institutes are government bodies or organizations. So if they want to be strengthened, then the government itself should allocate finance for evidence generation. So I think we need to put this point in this phrase.
Okay, thank you. We'll definitely reflect on how best to do that. Thank you. Shiva. And then Felix. Shiva and then Felix.
I just want to repeat that this is a historical period, just like it was between 2020 and 2023. Between 2025 and 2030 is going to be very critical for public health. So just the wording and the key messages should resonate with policymakers, politicians, parliamentarians, professionals. And the message should be precise. So I just want to bring up this issue of strength, excellent document, strengthening and expanding regional and global networking, exchange, and partnerships, because we have had a lot of partnerships and networks, but have they made a great difference? We have to learn from the past. And the emphasis on exchange, two-way exchange. Mm-hmm. The other one is evidence to inform health policy. We have had a lot of health policy, but I think we should emphasize on public health policy. Mm-hmm. A small wording, but it does make a big difference between the bigger whole and the public health, surgical public health, as we would call it. If you go up a little bit, please. Just above we commit.
Sarah, can we go up a bit?
And in the wordings, if you could, we have promotion, prevention. The area of protection is missing in the wordings. along the way. It could be inputted, but I'm being very picky. But I know public health without protection means no legislation and regulation. If you go up, please. Just there, please.
Stop.
Again, I come back to uniformity with WHO documents, which all of us have contributed to. And I refer to the roadmap on essential public health workforce in building the competencies of a multidisciplinary public health workforce. So I would really again bring public health and then links very well essential public health workforce and essential public health functions. So they go together. So I really want to emphasize the issue of workforce. Then on the available global funding, we have learned the hard way that it should start with domestic funding, as my colleague Natalie brought up. Without domestic funding in the future for the National Public Health Institutes, we can't go further. That's all. Thank you.
Thank you, Shiva. Very, very helpful. Thank you, Felix. And then I will just check again, but then we'll try and close this. Thank you.
Thank you,
Felix.
First, well, I agree with the last comment.
Yes.
I really think it's an excellent document. I want to congratulate how it was built and done. Just very quickly, for the first time in more than 10 years, I will disagree with my friend Jean-Claude. I think observatories is observatories. It's not observation. It's a program. It's a field. It's a field of work. Many countries have it. It's just a setup of observatory. I'm sorry, Jean-Claude.
I think that was quite a powerful ask from a number of our colleagues. We need to see if we can reflect that in a way that's helpful to them. Really, Shiva, do you have to? All right. Okay.
One thing which we will fail in public health and universal health coverage is we don't put primary health care. And I can't see primary health care anywhere, not even one mention.
Okay.
And you cannot achieve public health or universal health coverage with poor primary health care.
No,
Thank you.
It's the foundation for everything we do. Right. Angela?
Thank you. I was just wondering, against the background that multilateralism is currently being called into question, and NPHIs are not political but scientific organizations, but still not unaffected by it. I was wondering if above the section we commit to, there could be an introductory sentence, maybe to the effect of IANPHI is both proof and advocate for the need and effectiveness of multilateral collaboration to tackle global health challenges.
Thank you. Okay. But I think we've captured all of that. I've seen Neil scribbling away. Can I seek the agreement of the room to complete this statement, knowing that we will think hard on all of the contributions, thank you, and get this to a completion, but only with your authority that we do that. Can I take that consent? Thank you. Thank you, everyone.
I'm getting. My only two suggestions. There's this word strong, which should be stronger in one of the bullets. And the other suggestion is that it's a reference document, so it should be numbered. So for the future reference, all the back to you. Now, thank you so much, audience, for your patience and your time. Dr. Eduardo, for your concluding remarks, please. Over to you.
Yeah, thank you, Amar. So I'm happy that the statement has been, we come to a consensus on that. We are proud on this Maputo declaration, Maputo statement. We believe that will not be a document that will be just put in the drawer. I am fully confident that this document will be used, will be referenced, and then will make difference. So thank you, everyone. And I, as the Director General and the co-host of this meeting, I am really proud. For me, that is the great achievement of this meeting. So, as I say in my opening remarks, that good ideas, they are only useful if they can translate into action and changes. I think this is the first step. We had good ideas during the meetings, but we should ensure that those good ideas, they can transform public health, global health. And then this statement is the beginning of that journey after this meeting. So I was reading one of those days, the 7 rules of a eagle. And then there is one rule of a eagle that I feel myself now in that rule. It's that eagles are built, is the only animal in the earth, in the animal kingdom, that they have specific features biologically. And then they are the only bird that can fly at high altitudes that other birds are not built for. And because they build at so high altitudes, when they are there, guess who they meet? If one eagle is flying at that altitude that other birds are not built for, guess who you meet there? They are not pigeons, they are eagles. So I read that they don't flock, so you don't see too many as other birds. So there are not many birds as eagles that can fly at those very high altitudes. And then those that are able to reach that altitudes, they are the one that join this specific species, so eagles. So in this meeting, I feel myself among other eagles that have been able to fly at high altitudes that I feel myself I've never flown before. And that was because I am among the few birds in the earth that are eagles. So I feel myself among eagles. So that's to say that I am really proud that this meeting, so important meeting on the very smart people, people that really make difference in this planet. They have come to Mozambique, they join us during those 2 days. And then we have really great discussions. So today, this afternoon, we had a meeting with our head of states because on the request of one of the participants, the Director General of Africa CDC. And then during that meeting, I feel myself very happy because Mozambique head of states, he said that he listened about this meeting on the news. And then he felt himself very proud that Mozambique is being able to host such an important meeting. So this is to say that the importance of that meeting is beyond the discussions that has been happening during those 2 days. Is beyond the ideas, is beyond the networks. It goes above that. So this has been having a tremendous impact on our NPHI. So thank you for coming and helping to height and to elevate our NPHI in Mozambique. This meeting for me has given also visibility. That has been we have went through very painful times. As we have said yesterday, I will not repeat about that. But coming at the end at this stage, all pains that we went through, all difficult that we struggles and challenge and uncertain and fears that we faced. So to me now, I have the proud to say that it was worthwhile. So, and thank you. So many of you, you have traveled for long distance, so for long flights. So, and thank you for coming. And I want to express my gratitude. And then have a nice flight and a nice trip back to your homes. And then hope to see you soon. But before I close my final remarks from the Institute, I want to thank my team that some of are in this room. So Sofia Viegas is my deputy. So she's a very strong woman. So people used to say in Mozambique that beyond a strong man, there is a stronger woman. And I have to tell you that I have a stronger woman within the INS, that is Sofia Viegas. There is Rufino, that is one of the most important people that has not been able to be in this room. And then there is my team, that the drivers, people of communication that has done a great job, people that has dealt with all logistics from your arrival at airport, So to ensure that this meeting would be conducted and in a smoothly manner. So for all my team that were behind the scenes, so I will ask you for a strong applause to them. And lastly, to IANPHI, so all the IANPHI team from Duncan to Anne, Catherine, Sarah, so apologize, I will miss for sure some of you. So the program committee, the committee for the agenda, the committee for the statement. So for all of you, so thank you so much. So you have been extraordinary along those days, having many calls, many Zoom meeting, MS Team meetings. So thank you all for spending your time and dedicate your effort. Without your support, we will not be here. This meeting wouldn't be successful as it is. And thank you all.
Thank you so much. And as you said in my own language, Iqbal, the great poet, said, "Tu shahi hai basera kar pahadon ki chatanon par." That means you are an eagle, rise above the skies, stay on the top of the mountain, and you are. Thank you so much for all you have done. Now, ladies and gentlemen, we have an announcement that this year you are in Maputo. Next year, Dubai has been selected for the IANPHI event, and following year it will be in El Salvador. Now, taking this opportunity, we have Dr. Ali Munil Al-Rahma from the Dubai Health Authorities. So we would ask him for a few words, please.
I'm sorry to be the last speaker today. I'm sure you're very excited. Distinguished and esteemed public health leaders and colleagues, it's really a great privilege to be standing before you today. As we conclude the insightful and enriching IANPHI 2025 annual meeting, as we all discussed and saw over the past 2 days, we have engaged in deep discussions, exchanged valuable knowledge, and strengthened our collective commitment to advancing public health on a global scale. We began our sessions by focusing on how sustainable development goals serve as a guiding framework for improving population health and overall well-being. From the experiences shared by the National Public Health Institutes worldwide, it became clear that achieving the SDGs requires robust strategies, cross-sectoral collaboration, and a deep understanding of regional challenges. We also explored the importance of appropriate methodologies, metrics, indicators to assess the vulnerability and resilience of public health systems. By applying the right tools, we can better identify public health risks, evaluate system performance, and ensure that our policies and interventions are equitable and evidence-based. Additionally, the sessions emphasized the critical role of national public health institutes in shaping policy and emergency responses. We examined how public health policies can be localized and adapted to specific contexts. We also examined starting with the infectious diseases outbreaks to climate-related health challenges. National public health institutes continue to be the forefront of national and regional efforts to safeguard public health. As we reflect on these discussions, one thing is abundantly clear: collaboration, knowledge sharing, innovation, funding are the cornerstones of a resilient and future-ready public health systems. With regards to announcing the IANPHI 2026 annual gathering, it is with great excitement to announce that the Dubai Health Authority will be hosting the meeting in Dubai, United Arab Emirates. As you know, Dubai Health Authority is the regulatory authority responsible for public health in the Emirate of Dubai. Through visionary leadership, strategic planning, and strong commitment to innovation, Dubai Health Authority has been instrumental in shaping public health policies, healthcare services, and disease prevention programs in one of the world's most dynamic cities. Hosting the IANPHI annual meeting in Dubai presents a remarkable opportunity to continue the meaningful conversations we had here in Maputo. Also, it will allow us to showcase Dubai's advancement in healthcare, digital health transformation, and pioneering public health initiatives. A very quick overview of Dubai's public health. Dubai Public Health Protection Department, which is under the umbrella of Dubai Health Authority, plays a vital role in preventing both communicable and non-communicable diseases while promoting health and ensuring well-being. The department encompasses various specialized sections, such as school health, which ensures the well-being of the next generation, disaster management, enhancing preparedness and response strategies, research and programs, driving data-driven decision-making, health promotion and education, empowering with the communities with knowledge, and preventive medicine to reduce the burden of communicable diseases through early intervention. And finally, the occupational health, which safeguards workforce well-being. Each of these components reflects Dubai's commitment to excellence in public health and its dedication to ensuring that every resident and visitor has access to world-class healthcare services. Beyond public health, Dubai is a city of inspiration, innovation, and inclusivity. It is a place where tradition meets modernity, cultures converge, and future-forward solutions drive progress, from advanced medical infrastructure to its role as a global business and tourism hub. So we are excited to welcome you all in Dubai in 2026, where we'll continue our mission all together. And we'd like to play a 1-minute video. Very much, and hope to see you all soon.
Thank you so much, Dr. Ali. Now I finally hand over to Professor Duncan for his concluding remarks.
So thank you, Dr. Ali. Thank you. And Dr. Eduardo, we're proud of you. So make sure that's conveyed. I hope very much that everybody's got the message about the honor we've had in being here. Sophia, you too. Thank you. Right, I've got at least an hour's worth of comments here. We must remember to thank the interpreters. If we can do that, everybody, please. I've always written notes that I can't read. I don't know if anybody has. I don't know why I bother. A few asked over lunch today about, with Anne-Catherine and Neil, slight delay, because Neil will start on the 1st of May, formally. Between now and then, people just normally communicate with the Secretariat team. That's what people normally do, through Marie or colleagues. I'm obviously fully available, and I'll be backing up the team. Neil will be beginning his induction, and Anne-Catherine making sure that the handover is as good as can be. And we've talked about that. It's just if there's any doubt, Neil starts on the 1st of May. Between now and then, normal business with the Secretariat, and the good news is I'm backing them for the next 2 weeks. Right, I can't read it. Thank you to everybody and to the speakers. Won't repeat what's all been said, and thank you to you. Safe travels home for those that are here tomorrow. Safe travels the weekend for those that are staying for the weekend to spend some time in this beautiful country. We hope you have a wonderful time, and see you somewhere. Bye-bye.
Thank you so much, Professor Duncan. And not forgetting, we would like to extend gratitude to the hotel staff, all the telecommunication teams, our own teams who have been working behind, who have not seen, and not forgetting the people who have remained online, the participants over there and the participants over here. Much grateful to all of you, and for all those, even we have come across from the airport to your staff. So thank you so much, and see you soon, inshallah. Thank you.